The Brain and Spine Surgery Consortium in Abuja specializes in increasing access to neurosurgery problems such as neck pain, back pain, epilepsy, brain tumor, and conditions causing paralysis. For more information, call us on 081 2222 1616 or find us on Facebook.
I have with me this Saturday Dr. Biodun Ogungbo of Brain and Spine Surgery Consortium here in Abuja. And he has been on this show several times. It's the clinic, and he has just been a very great resource. Welcome to the clinic again, Dr. Biodun.
Thank you very much. Thanks for having me.
This is very personal to me. This interview is very, very personal to me. So I really want to let the word out. I want to understand why this happened. So what causes heart attacks? What is a heart attack, first of all? And then what causes heart attacks?
Heart attacks and strokes, in a way, are quite similar because both of them simply means that there is no blood going to either a part or all of the heart, or in stroke, there is no blood going to either a part or all of the brain, which means the heart in heart attack suffers. The heart is a very important organ in the body, and it's a specialist in a way. It does its job, and it does it while we're asleep. It does it even sometimes when people are dead. The heart keeps beating, so it needs constant supply of oxygen. It needs constant supply of blood to it.
Okay.
So if it doesn't get that blood, that area of the heart might die, or the whole of the heart might die. So a heart attack will happen most especially when there is no blood supply to a part of the heart. That part of the heart then starts to suffer because there's no blood coming to it, there's no oxygen going to it, there's no food going to that part of the heart, and so that muscle can die. If it dies, then sometimes it leads to, we have the pulse. The pulse might then become abnormal. The heart starts beating erratically, and then that person will complain of a chest pain, that they feel a horrible pain in the chest, in the region of the heart, and then they might go faint, start being sweating because the heart is having to work extra hard, and as soon as it starts malfunctioning, the heart rhythm is not going on quite well, it will affect blood supply to the brain. They can go unconscious. From then on, they will die. So it's a big issue.
Yes, I'm going to say this. I'm going to say it because, like I said, it's very personal to me. Now, my dad was hypertensive and he was diabetic. Do this contribute to heart attack?
They certainly do. There are perhaps the two major reasons, or risk factors as we call it, for someone to have a heart attack or a stroke. Hypertension is a very, very huge risk factor. Diabetes is also a very high risk factor. Other things like obesity, cholesterol, a lot of cholesterol in the body, and of course smoking. Those four are big risk factors, especially for a heart attack.
Okay, before he died, last year or last 2 years, he had a mild
heart attack.
No, stroke.
Okay.
Partial stroke.
Okay.
Yes,
okay.
that was what happened.
Okay.
He was in the hospital
Okay.
for a few
Okay.
days and he got himself back.
Okay. Okay.
So now I'm wondering what happened that led to the heart attack, because at some point the diagnosis was he had an enlarged heart, and all that. So I'm just trying to wrap my head around all these things. What exactly happened?
I think this is important because you now have somebody who has hypertension, who has diabetes, who's had a mild stroke. That already indicates that he has significant risk factors for further strokes and for a heart attack, because all it means is that the blood vessels, we can call them pipes, carrying water into the house, is becoming blocked bit by bit. So reducing the amount of blood going to the brain, and same thing, the amount of blood going to the heart. So at some point in time, maybe that these pipes that are carrying blood, then blood becomes blocked completely. If that happens in the case of the heart, then that means somebody's turned off the tap, there's no water going to the house, there's no blood going to the heart, that area of the heart will die. Same thing is what causes a stroke. Once the tap is completely shut off, that area of the brain will also die.
I know diabetes is genetic.
Diabetes can be, yes.
So all these risk factors, are they genetic? Once a member of your family has this, are you...
No, it doesn't compute like that. You are at an increased risk.
Okay.
Because you are in the same environment, you're living under the same conditions, you're probably eating the same kind of food, so you are exposed to the same environmental factors.
Okay.
So that comes into play. It doesn't necessarily mean that because your father has hypertension or because your father, has diabetes or, has a stroke that you would definitely get it. It doesn't work like that.
Okay.
But you have an increased risk because you're exposed to the same environmental factors. So it might be for, a family where, everybody keeps saying, oh, we're big boned in our family, and they're all actually obese. So they're all exposed to that same kind of food, same kind of sedentary living, thinking, oh, we're fat or we're big because we're big boned in our family. Well, it may be that you're all just obese because you eat the same kind of food.
Okay.
And so you have high cholesterol, you now have, increased risk of stroke or heart attack in that particular family, but it's an environmental factor rather than a specific genetic problem.
Okay, so let's talk about prevention. Exercises, yes. Nutrition, diet.
Very important.
What else can you do?
Specifically for those who have a risk factor, and that's one of the major jobs for doctors, is to find out who has what risk factor. So we actually push and advocate that every time you go to a chemist or you go to a hospital, somebody should check your blood pressure. It's as simple as that.
Okay.
Or also check your blood sugar. You just regular checks like that, even done, either for a small fee or completely free of charge, is what kind of services chemists, pharmacists, and hospitals, clinics should be rendering. We should be doing that as a service to the nation, to be honest with you. So you just keep an eye on things and know what the numbers are. What's my blood pressure this month? What is it next month? And if you start seeing changes, especially if the blood pressure is climbing up and up and up, then you start pulling back. Either you reduce the amount of stress, or you start exercising, or you actually go ahead and take medication for it. You can only know if you have the test. So that's one important way of preventing these issues, is by not just assuming that it's going to be okay because you've gone to church and the pastor has prayed for you. No. The next step is pastor's prayed for you, but find out what exactly your blood pressure is, what is your sugar level, what is your cholesterol level. All these are important. Keep an eye on your weight, for example. There's no reason for anyone to say in this day and age, oh, I'm a sugar mommy, or I'm a big mama, or whatever. No. You're unhealthy, you're obese, you are, close to death if you don't look after yourself. So we must all do some form of exercise which keeps the muscles working, keeps the heart and the brain especially in top condition. This is very important. And some people will tell you, oh, I was treated last week for high blood pressure, I'm okay now. Hypertension, for example, doesn't go away. If you've been diagnosed as having hypertension or having diabetes, more than likely it's there for the rest of your life. It means you have to keep managing it. It may not mean taking tablets, but at least you'll be doing something. Even if it's just watching your diet, even if it's just doing exercises, you must be doing something for the rest of your life to keep it under control. A lot of people just ignore and forget about it and think, yes, the doctor gave me a prescription for 2 weeks, the drugs are finished now, I'm okay now. But you ain't okay.
Do we really take obesity serious in this country?
We don't. Some people think it's a status symbol. Some men think, because they have like a 9-month pregnancy in their stomach, because they've been out drinking alcohol, at all hours, that means they're having a good time or they're having a good life. No, you're just storing up trouble for, yourself and your family.
So much I would like to talk about, but I don't want to get emotional right now.
No.
I really don't want to. So, but I think the message has been passed.
But the other thing, of course, is if somebody has had a small stroke, or if somebody has had a small heart attack, I like to say to my patients that that's actually a warning sign from God.
Okay.
That you have some risk factor, and this is like a taster. That is actually the time to find out why you've had a small stroke or why you've had a mild heart attack and do something to prevent the big one. It is so vitally important for people to understand that when God has tested you a little bit, giving you a mild heart attack or a mild or a partial stroke, realize that it's a warning sign that there's a big stroke or a big heart attack coming unless you do something serious about it. That's not the time to be relaxed and think, oh, I'm okay now. That was a warning. For the rest of your life, you must be doing something to make sure you prevent the next heart attack or the next stroke. Very vital. There are 2 things to do. Number one is focusing on lifestyle changes.
Completely.
Complete lifestyle change. So for people who smoke, no more smoking. Those who drink alcohol, no more alcohol. Those who are obese and, have a sedentary lifestyle, you need to get off your backside and start doing some exercise. So those are important things within the family or in the house to do. And, if need be, get a dietitian so that they work out exactly what kind of food, what type of food, what amount of food to eat. Those are very important. The second most important thing is to actually know that you have seen a specialist. So for stroke, for example, you need a specialist in neurology, somebody who understands strokes, who will prescribe the right medication, and who will have investigated to find out why did this person have a stroke, what part of the brain was affected, how do we prevent the next stroke. So the major job for the specialist is how do we prevent the catastrophe that's just around the corner. So even for heart attacks, you see a cardiologist. They will check the heart. They will do tests to see which blood vessel in the heart, which pipe had stopped carrying blood to the heart. And in fact, can we reopen that particular blood vessel so that we can prevent another heart attack? Those are the issues. So one is within the family, lifestyle changes. The second is to actually see a specialist that will find out to the barest detail what exactly happened, why did it happen, and by God's grace, how do we prevent the next one that's coming? Because it is coming. That's the sad thing. Because once you have a risk factor, unless that factor is eliminated, you still have the risk factor for another stroke or a heart attack.
The Brain and Spine Surgery Consortium in Abuja specializes in increasing access to neurosurgery problems such as neck pain, back pain, epilepsy, brain tumor, and conditions causing paralysis. For more information, call us on 081 2222 1616 or find us on Facebook.